The unintended consequences of the Affordable Care Act. An insurance expansion bill was introduced at the state level in Massachusetts during 2006. After his 2009 inauguration, President Barack Obama announced his desire to work with Congress to compile a health reform bill, comparing his plan to that of Massachusetts. The Senate Finance Committee met over 31 times, over a course of 60 hours to create the bill.
The Affordable Health Care for America Act passed 220 to 215 in the House of Representatives on December 23, 2009. The Senate voted 60 to 39 to end debate on the bill on January 19th. The House abandons the Affordable Care Act for America Act and passes a more moderate version of the bill endorsed by the Senate, the Patient Protection and Affordable Care Act. House Democrats agree to pass the Senate's bill on the condition that it be amended with a subsequent bill, Healthcare and Education Reconciliation Act. The House passed the Senate bill on a 219 to 212 vote on March 21, 2010. Obama signed this bill into law on the 23rd, with the subsequent bill, the Healthcare and Education Reconciliation Act, signed on the 30th.
One of the major components of the new bill, the employer mandate, has influenced both big business and small businesses, and will in the future. Employees with at least 50 full-time employees, or the equivalent of, must provide health insurance to all or incur a penalty. Economists contend that the bill encourages employees to hire part-time for exemption from the mandate. Employees may have to cut hours, employees to cover health insurance. Many believe that this will affect hiring employees for small businesses. Businesses with 10 or less full-time employees with an average salary of $25,000 or less are eligible for a full tax credit on health coverage. Firms with lesser than 25 employees are eligible for a tax credit on the condition that they cover at least half of the health insurance. Businesses with the equivalent of 50 full-time employees or an AAS of $50,000 or more are phased out almost completely from the tax credit.
Only small businesses are exempt from providing insurance in 2014 without incurring a penalty. The penalty is $200,000 per every full-time employee after the first 30. The employer cannot provide old coverage to avoid this penalty. Coverage must be under 9.5% of the employee's household income. There should be a drop in spending for jumping to an increase of $50 billion spent on healthcare by 2019.
Writers all over prestigious papers and websites have claimed that America is becoming a part-time nation due to this bill. The average American work week has been reduced from 34.6 to 34.5 from March to just July 2013. This changes accounts for 11.5 million hours of lost work output in the American economy. The employer mandate is delayed until 2015-2016 as businesses scramble to account for the new health coverage expenses. For every full-time job added to the American economy in 2013, there were 4.3 part-time jobs created. This is actually a reverse role. Normally, there would be about 5 full-time jobs for every part-time job created. The cyclical rate is about 5 jobs created for every part-time job.
With the new bill benefiting those who cannot afford health insurance, there will be a higher federal budget for health care, which will subsequently result in higher taxes. Higher taxes for the consumer could be reflected by cutting back on spending and hurting businesses. The new student loan program reduces the adjusted gross payment from 15% to 10% for medical students. Students also have the option of forbearance, the option to defer payments until graduation. A more expensive option, however, because interest accrues.
Though many businesses are having a hard time seeing the benefits for them for this bill, there are many medical benefits of the ACA. First, it eliminates lifetime limits on essential health care. Insurers are prohibited from raising premiums or dropping a client entirely because of an illness. And children can stay on parents' plans until the age of 26, which is much easier with the new college loans, putting these young children in debt. More medical benefits include emergency care. You go to a hospital emergency room with a serious condition, such as symptoms of a heart attack or stroke. Under the new reform law, emergency room visits do not require pre-authorization. You can't be charged extra for an out-of-network visit. Mental health services. Many plans don't cover mental or behavioral health services, but that will change under the new health reform law. In some states, coverage may be limited to a set number of visits per year. Hospitalization. Under this new law, your insurer must cover your hospitalization, and you may have to pay 20% of the bill or more if you haven't reached your out-of-pocket limit. Rehabilitative services. If you are injured or become ill, many plans today will cover therapies to relieve pain, help you regain your ability to speak or work. Maternity-born care. Mothers and babies will now be taken care of. Pediatric care has become more accessible to the everyday American. The new bill requires insurers to cover childbirth as well as the newborn infant's care. Under the pediatric care, children under 19 will be able to get their teeth cleaned twice a year, as well as x-rays and medically necessary incapacitants for dental. Children under 19 will be entitled to an eye exam and one pair of glasses or set of contact lenses a year.
In conclusion, this bill raises the standard of living for the lower class American. The new IBR program will help medical students pay back their loans on a less backbreaking plan. Small businesses will benefit from the tax credit until they reach 30 full-time employees. More money is projected to be spent on healthcare. The money has to come from somewhere, either the federal budget or the rest of America.